cautious in how you move around while inside the operating room. Find your tech and your nurse. Please get your own gown and gloves. Ask lots of questions. Introduce yourself and write your name on the whiteboard. I have had a lot of inquiries. Med students, residents, PA students asking basically how it is the first time in the OR, how they can be the most helpful, what to expect, what they should be doing, right? Typically, you are already going to know what surgeon you are going to be with, whether you're following a PA, whether you're a med student, resident. So first, go to the charge nurse. The charge nurse should have an answer to the question of which room your surgeon will be in. Or there should be a board right there that has all that information for you. Yeah. The smart thing for you to do is not to burst into the OR. What you should do is try to find your tech or your nurse, which if that room is open, they should be in the room, which you should not enter without a mask first, because they will be open with all of their sterile supplies. Before you go past the red line in the OR, you will need to be wearing hospital-issued scrubs, which should be in the locker room. You might need a code to get your scrubs, so make sure to ask that question, where you can get your scrubs and how you get them. You will find the OR hats, shoe covers, and masks somewhere before the red line. Yeah, you will. Cover your hair on your head. Put your mask on and cover those shoes if you don't want them getting bloody. And at this point, you are allowed to cross that red line. But when you enter the room, make sure that you are covering your nose and mouth with that mask. When you enter the operating room, please do not touch anything blue. No, don't even go near it. Bad idea. Don't make sudden movements. You will most definitely frighten your OR tech and your nurse. They have spent a lot of time getting the equipment and sterile supplies ready for this procedure. So if you contaminate their back table, they then have to break down the entire thing and start over again. Do not expect anyone to get your gown and your gloves for you. Please get your own. Please make sure to communicate with the OR staff. Write your name down on the whiteboard in the room as well as your title, as it will need to be charted by the nurse. Please be extra cautious of your surroundings and the sterile supplies. Make sure that your hands remain nipple to belly button or nipple to navel, we say. Just put your hands like this. If you are asked to change your gown, don't take offense, please. When the procedure is over, please stick around to help move the patient over. There are plenty of times that the resident or medical student or PA will leave. We no longer have enough hands to move this patient over onto the gurney after the procedure has finished. So to gain respect from the OR staff, I promise you, they would appreciate you staying after and helping move that patient over. Good luck.